Hi, my name is Dr. Lisa Fiore, and I'm Director of Early Childhood Education Programs at Lesley University out of Cambridge, Massachusetts, and I'm a developmental and educational psychologist. I'm here today with Dr. Josh Davidson, who has taken time out of his day to speak with us about allergies that affect children and families. Good morning, Dr. Davidson. Thank you so much for taking time out to speak with us.
No problem.
Could you tell us a little bit about your practice?
Sure. I opened the practice about 14, 15 months ago, so it's still a very new practice. We treat all sorts of allergic conditions here, so hay fever, food allergies, eczema, asthma, and we see children and adults. And it's been fun because I grew up here, so it's been a bit of coming home and opening up a practice in my home community, which is nice.
Do allergies run in families? You say you treat children and their families. Do you notice that in families?
Absolutely. It largely depends on the type of allergy you're talking about. There's generally 4 things that do tend to run in families, and that's asthma, hay fever, food allergies, and eczema. Some people ask about things like medication allergies, for example, or bee sting allergies. Those kind of things tend not to run in families. You can certainly see it in a parent and a child, but technically speaking, they're not inherited.
Yeah, you mentioned bee stings, for instance, which makes me think about the fear associated with allergies, things like nut allergies or egg allergies. So are there trends that you see? I know parents of children are often very worried about their child having a reaction to these things.
Absolutely. Food allergies specifically have grown in terms of the incidence that we see from even 10, 20 years ago. I mean, I think back to when I was a child, and I don't even remember knowing another child who had a peanut allergy or an egg allergy. There may have been, but I just don't remember. But we do know that the incidence has risen tremendously, so with that comes a great deal of fear, and you see a lot of preschools and other schools that are peanut-free. There are peanut-free tables. It raises all sorts of issues, not only for the school, but for the individual child who has to maybe sit on their own while they have their lunch, and it can be very difficult.
Right. I know my daughter is often glad when she's invited to the peanut-free table. Children get to bring a friend, so it's a source of pride. So what do you say to parents who have a child diagnosed with a food allergy? Is it a life sentence, or does this sometimes diminish with age?
It's a good question, and it's one that comes up probably right after you let the parents know about the food allergy. It's the first question because parents are often worried, is my child going to deal with this forever? And the answer really depends on the food in question. So, for example, we know that with eggs and milk, it's a very good story in the sense that 85 to 90% of children will outgrow their allergy by, kindergarten or so. Beyond that, most will eventually outgrow it if they haven't by that age. Unfortunately, at this point, for things like peanut allergy, it's almost the opposite. It's about 20% or so will outgrow it. The good news is that we're working on ways to treat food allergies, which should be a source of encouragement or reassurance for the parents. In the same ways that we give allergy shots for things like pollen allergies, we're working on ways to give very, very small amounts of peanut or other foods in an effort to sort of build up a tolerance to those foods. So I often tell parents that in your child's lifetime, even within the next 10 years or so, we'll probably have ways to treat food allergies too.
So what are some signs to look for if a parent's worried that their child does indeed have an allergy to eggs or some other?
Sure, and that's tough because a lot of times it happens, they're obviously not testing their child. The child will get the food and react. I'd say the most common things you'll see are largely related to their skin. So very often the first sign will be hives or a rash on the skin. And that generally will happen within 30 minutes after eating the food. So occasionally you'll hear a story where it was the following day or something like that. And in those cases, largely it's another reason. It could be a virus that's caused the rash or otherwise. But usually I tell parents it's within 30 minutes and usually starts with the skin. It certainly can progress, and in more severe cases you'll see swelling. Sometimes a child might vomit because the body is trying to get rid of this food that it's allergic to. And in rare cases, they can faint, and that's certainly the more severe reactions.
Sure. So I guess bottom line, if a parent is concerned, call the doctor.
Yes, very, very important to do so.
Right. And so how about with adults? Asthma I know is a big concern for adults as well as children, but do you see trends with adult allergy symptoms, skin or other?
Yeah, I mean, I think you see less food allergy, for example, with adults, although you definitely see things like fish or shellfish allergies with adults. So that's an example of how food allergies can still affect an adult population. But you're right, asthma, here in Los Angeles especially, unfortunately in areas where there is more pollution, you do tend to get higher rates of asthma. So when the Santa Ana winds come, for example, and we get more pollution, asthma tends to be more of an issue. And it can be difficult to control.
And so asthma, what does that look like to someone who might be experiencing symptoms and not even know that he or she has asthma?
Good question. I think it's depends with kids and adults as well. For example, in children, they're so resilient that they can look great in between episodes of an asthma attack. The biggest trigger for children tends to be colds, so they'll get a virus soon after they go back to school, for example, and their asthma will flare. With adults, they tend to have symptoms more consistently. So they'll be dealing with a cough that tends to get worse at night. They may be wheezing. With certain things like exercise, it can sort of bring out the asthma symptoms. And certainly viruses can cause symptoms in adults as well. But in general, adults tend to have more consistent symptoms versus children who tend to have a more sort of up and down type of pattern to their asthma.
Right. And so these are treatable symptoms, and what's the most common course of treatment so that people can get a sense of what's
Yes, there is hope. With treatment for asthma, generally starts with a rescue medicine. So one that many people may have heard of is albuterol. That is comes in an inhaler, or a puffer, people will call it. And that generally works to quickly relieve mild to moderate asthma symptoms. Of course, there are patients, a lot of whom I see, because they tend to be a little bit worse than others, will require other medicines to help control their asthma. And that's generally considered a step above and beyond the simple rescue medicine. So there's, fortunately, many good medications nowadays versus 15, 20 years ago that did not exist to really help control the symptoms. And that has become the real focus with asthma, is to just keep things under good control.
Right. And so generally speaking, if someone has a feeling either they're suffering from asthma or they're generally feeling they're suffering from any allergic problem, what's the best course for a patient to take? Do they go to their primary care physician, or do they come to an allergist and say, I'd like to be tested?
Good question. Yeah, I think it really depends on unfortunately, it depends on insurance. But that being said, I think an allergist is best suited to do allergy testing, certainly, which can be a large trigger for people with asthma or other forms of allergies like hay fever or eczema. So with allergy testing, generally it's a skin test that can be done within 10 or 15 minutes, so in the same visit, and you can rapidly identify any triggers that could be causing a lot of these symptoms. And that raises a good point about avoidance. So if we can help patients learn to avoid what they're allergic to, that can go a long way and actually lower the amount of medicine that someone needs, which is always a good goal. We always try to minimize medicines.
Right. Well, there's been some research now indicating that allergies have an impact on children's learning and children's behavior. And so thinking about advising parents to treat their children or bring them in at least for a diagnosis or attempted diagnosis. Have you heard anything about that? Are you seeing parents with those concerns? Definitely.
I think it speaks to really any chronic illness, I think, in children can cause or form an obstacle to effective learning. And allergies, because it happens to be one of the more common chronic illnesses, is something that I will see. And if you have a child in a classroom who is constantly worried about their nose running or breathing, if they have asthma and they're having trouble, it's extremely difficult to focus and learn. It's as simple as that.
Very stressful too.
Yeah, stressful, and they're worried about their appearance to other kids. I mean, it really ties into a lot of behavioral issues and can be very difficult for kids.
So we've talked a lot about children and families, so thinking from the young child throughout the lifespan, older patients sometimes experience reactions to medications or other environmental irritants. So could you tell us a little bit about that and how your training has helped you encounter those situations?
Sure. It's a unique population, much like young children are, and so different issues do arise. In the senior population, largely because they are taking more medications, they get into more medication allergy situations. And that's definitely something that I can deal with as well. I would say largely the most common source for medication allergies are antibiotics. And I do have specific testing available that I was trained with in my fellowship and feel very comfortable with, specifically for penicillin and for penicillin-related antibiotics. So things like amoxicillin and a lot of the other cillins that we all know about, I can test for, and you can safely determine whether someone is allergic to it or not. And as I said, in a group that's taking many more medications generally on a daily basis, that becomes a big issue because you don't know which medicine it is. And obviously you don't want to remove a medicine that can be very helpful in terms of blood pressure control or diabetes control or otherwise. So you want to make sure that you're focusing on the medication that is truly causing the problem.
Right. So I understand you've started a support group. How
Yes.
can that help parents and other adults or individuals?
Sure. Yeah, I thought it would be a nice idea for the South Bay in general. I began by researching, obviously, to see if such a thing existed, and found no such resource, and thought that it would be a nice opportunity for parents of children with allergies, or certainly adults with allergies themselves, to sort of come together in a very comfortable, casual environment. Not to replace a visit to the doctor, but just to discuss common concerns and ways that on a day-to-day basis allergies can be difficult to deal with. And this applies to all forms of allergies, again, from asthma to eczema to hay fever, more simple things like that, or certainly the more complicated issues. So I think people can draw strength and comfort from others who are dealing with the same issues, and I hope to serve as a sort of a guide to these issues and ways to help people deal with it.
Right. I think that's wonderful, because I know parents and caregivers feel so isolated as it is, and feel like this is only happening to them.
Right.
And it's nice to find others to share funny stories as well
Yeah,
as some
exactly.
poignant experiences.
Keep it very
as
relaxed.
well.
That's the key.
Right.
Yeah.
And so there are products and services available that you could help facilitate
Yes.
the use of for families.
Absolutely. There's with the internet is an amazing resource. It has its good and bad parts. Very often I'll hear parents talk about, oh, I went on the internet and got lost because I don't know what to believe and what not. And it's a simple but a good example of how I might be able to direct people to certain resources that I know are accurate and offer. For example, there's the Food Allergy and Anaphylaxis Network, FAAN or FAN, and foodallergy.org is their website. It's a great resource. And it's probably the top resource I'll send people to for food allergies. Again, it's an example there. But parents will often say, what do I cook for my child? I'm worried about their milk or egg allergy. I want them to have a birthday cake. What can I do? And they have recipes on the website. So it's a very effective but simple idea that can really make a difference. So their child gets a birthday cake, which is important.
Right. So I'm sure one of the biggest goals for you as an allergist, a physician in general, is to help people live successful lives and to live as uninhibited and without as many barriers as possible.
Sure.
So, if you have a message to tell parents and children or others of varying age groups, what might you say to them?
Yeah, I always say there's hope.
Right.
There's, depending on again, from one condition to the next. One of the major reasons I also became an allergist, I have allergies and asthma myself, and I know what these patients are going through, and I have been able to sort of get through it. And I share that tidbit with families and with children, and let them know that there are effective ways to deal with this, whether it be peanut allergy or asthma or otherwise, and I can help you get through it, not only through medications, but with some of the resources we've mentioned as far as the internet or otherwise, or the support group, to do everything and anything that any other child or adult does who does not suffer from these issues. I often raise the example of Olympic athletes who have asthma. Many Olympic swimmers, for example, or track athletes have asthma, and they're winning gold medals. So if they can do such things, then there's no reason that another child or adult can be successful in whatever it is they want to do.
Right. There's whatever the old saying is about an ounce of prevention You know, what might you tell people so that they can be proactive in seeking treatment, so that they don't find themselves just struggling with symptoms, trying to tough it out? I think a lot of people look at the medical profession as something they have to deal with, rather than doctors necessarily being their advocates who are there to help them. So.
Sure. Yeah, and I think that applies very much so to allergies and asthma as well. We do a lot in allergy and allergic medicine with prevention. I mentioned earlier with controlling asthma. So control is essential for any sort of chronic illness, because we do know that over years and decades in an individual's life that with asthma, for example, irreversible changes can eventually occur. And we're talking, you know, 30 years down the road here, but, you know, if you have a child and you want to keep them healthy throughout their lives, that becomes important. So, for example, with asthma, some of the most common sort of red flags to look out for are, especially in adult, but also with kids, cough or wheeze, simple as that. But most allergic illnesses will get worse at night, so very often you'll hear someone say, my child awoke at midnight coughing, and he or she was fine throughout the day. And an adult might experience the same. Weather changes are another big trigger for asthma symptoms, and so I often tell people to look out for those weather changes. You know, we know that sometimes I feel like I have to be a meteorologist. I tell people next week, you know, it looks like we're going to get hot again, but it's important because those changes in weather can be a big trigger. For hay fever, especially in younger kids, it can be difficult because it's new, you know, so they may go from not having these symptoms to having it. It's very difficult to tell between a cold and allergies. That's a big question that comes up. And to answer that is to say colds tend to last about a week or two max. If this is going beyond that, and, you know, it tends to be a little bit more mild with maybe a clear runny nose kind of thing, that could be allergies. For eczema, which is an allergic skin rash, you know, there are some classic signs, and it tends to occur in the folds of the arms or behind the knees. If parents notice either in themselves, adults have eczema too, or in children that they have a rash over those areas, that also gets worse at night. You know, it's time to see an allergist. These are things that people don't have to deal with, that it may be something they feel like they can just tough it out and get through, but they don't have to live that way, and I can definitely help them, regardless of what allergic condition it might be, to get through it and to live a much more comfortable and hopefully happy life.
Right. So you made me then think of the home environment and things that we do have some control over. So what about common things in the home, pets, dust? What are some simple strategies that families can use to help deal with or reduce the allergens in the home?
Sure. Well, I'm a pet-friendly allergist, so I try not to tell parents the dog has to go or anything like that ever. There are many things that you can do in the home, and a lot of it depends on the allergy testing. It helps direct us in one direction or another. For example, dust mites. Dust mites are microscopic insects that we have in our homes, no matter how clean we try to be. They tend to be in our mattress or pillows. And since someone is sleeping on a mattress and their head is on a pillow, they're as close to something they're allergic to as they can get, short of someone who is peanut allergic and is eating a peanut. If you place a barrier in the form of a zippered cover around the mattress and pillow, you are limiting your exposure to dust mites, and that alone can make a big difference for kids or adults. Air filters, so HEPA filters, HEPA. These are high efficiency particle air filters that will draw in the air and actually trap pollen. They can trap dander from a pet. They can even trap viruses. They're that effective, and can definitely limit the exposure to pollens and dander that one might have. So, you know, those are some examples of ways to really limit one's exposure to things in the home environment that are simple, are not too expensive, but can make a big difference. And then voila, maybe your child doesn't need medicine 4 times a week, and they need it, you know, once a month or something. So I'm a big advocate for changes, simple changes in the home.
Sure. All right, so you mentioned eczema. So what are some other skin irritations or allergies that you see, and what can people do about that?
Sure, it's a good question, and the one that often comes up is contact allergies. So with hay fever, asthma, you're inhaling or breathing in things you're allergic to. Many people also suffer from allergies when they come into contact with something. So some common examples of that are metal allergies. So nickel is the most common metal that causes contact allergies, and that comes in the form of belt buckles, sometimes jewelry. So people will come in and say, I keep getting this rash on my stomach in the middle, and it's where their belt buckle is rubbing against their stomach, or they may have a ring or some jewelry. So someone may come in and say, my ear is red constantly when I wear my earrings, or my ring is causing a new ring is causing a red mark. These are contact allergies and are very common. One other one that comes to mind is latex allergy. So in the healthcare environment, certainly we're familiar with latex gloves, and many people will put on a latex glove and get a rash. It's another form of contact allergy. So the way we deal with that is with patch testing. It involves basically placing patches against the skin and keeping them there for about 2 days to look to see if a reaction develops. And it's an easy way, though, to diagnose contact allergies and to make a difference for people.
And I'm imagining things like fragrances, dyes found in shampoos and lotions and things like that. So again, similar to food allergies, people might not recognize it immediately. It might take a few minutes or something like that. Is that something with patch testing as well that you could figure out the root?
Absolutely. Common fragrances, dyes, they all are included in the patch testing. And you see it actually fairly often. It sounds like, with the dyes it might be fairly rare, but it's pretty common. It's not as common as hay fever might be, but you definitely see people with skincare products that have certain ingredients, such as lanolin is one that's on the test. Certainly the dyes are very common as well. So it's an easy way to quickly find out what may be driving some of those reactions. And the good news is then on the back end, I can actually produce lists of cosmetics, for example, that do not include this specific chemical. So you can then go to the store and whatnot and find those things specifically.
So if a label says all natural or organic, that does not necessarily mean allergy-free. It just means that materials are natural.
Exactly, absolutely not. And that is a very important issue with nutrition in general, but also with allergies. And we worry about labels for foods. We worry about labels for cosmetics and other things like that. So, for food allergic patients, the organic can be just as dangerous as the regular. If it has organic peanuts or non-organic peanuts, it's still troublesome. But labels are difficult to deal with, and I have ways to direct parents in terms of food allergies, but also with cosmetics, to look for very specific names, because it can be hidden. These ingredients can be hidden in an effort to make it seem more nutritional or nutritious, or in the case of cosmetics, to seem more natural, as you said. So I can definitely help with that and come up with lists to look for the 5 different ways that this ingredient can be mentioned.
So on the subject of food allergies and nutrition-related things, we hear a lot about gluten and gluten-free products and celiac disease, and I feel like I hear these terms more and more. Could you just explain for folks, what is gluten and what is all the hubbub? Gluten
is a very common protein that is found in many different grains, the most common being wheat. So it's found in wheat, but barley is another source. For some people, oats can be a problem. But I would say far and away barley and wheat are the most common sources that we'll find for gluten. And it's a very sort of hot topic these days. A lot of people are talking about gluten-free diets, and people often ask me, is that an allergy? And technically speaking, it really isn't. It is an immune response. So the body's immune system does recognize gluten in people who do have true contact allergy or gluten allergy. Their immune system reacts to it and will cause symptoms such as abdominal pain, diarrhea, bloating, things like that, but only upon contact with the gluten. So there are ways to test for it. Generally is with a blood test. It is not done with a skin test because, again, technically it's not an allergy. You could test someone to wheat and their allergy test will be fine, even in someone who has gluten sensitivity. So It is an immune response, but technically it's not an allergy, so the testing does differ a little bit, but it can cause a lot of the same symptoms. So some people will get a rash, some people will get belly pain, and there's even some evidence out there now for a connection between gluten and some sort of learning issues. So some parents will come in and say, I'd like to try a gluten-free diet because I've heard that it may be influencing the way my child is learning. So I have read some of that and agree with that in certain cases. So one just has to be very careful when you're avoiding gluten to maintain a certain level of nutrition. Because if you start removing foods, especially in a child, you have to make sure they're getting a healthy enough diet in terms of protein, calories, and whatnot.
And so you, in your training, you mentioned the training with regard to specific medications such as penicillin that people may go their whole lives not realizing they're allergic to until the time when they need to. So what else did you focus on in your fellowship, you said directly? So that was after you had completed your medical training and your residency. This is an additional piece of work that you went through.
Yes, more training. So it was after residency. I completed that at National Jewish Medical Center in Denver, Colorado. It's a national referral center for allergy and asthma. You hear it often comes up in the news in regards to tuberculosis. So the country and world's most difficult tuberculosis cases often end up at National Jewish in Denver, and the same can be said for allergic conditions. So we would receive referrals from around the country for very difficult food allergic patients or eczema patients or asthma patients, and deal with them and help get them better, basically, over usually a 2-week period. And what that helped with was it really exposed me to some of the most difficult cases, and I really learned the state-of-the-art techniques as far as dealing with these cases. And I feel very confident then moving forward in dealing really with any level of complexity, whether it's asthma, hay fever, food allergies, or otherwise.
Well, thank you. This has been so helpful and so informative, because there's a wealth of information, as you said, but as a parent or a consumer, it's often hard to know what to believe and what to trust. So I really appreciate you taking time to explain so many of these ideas and concepts to us.
Well, it's my pleasure. Happy to do it.
Thank you.